If you've been told you have spondylolisthesis in your low back and you're dealing with sciatica, you might feel confused as to why, what's causing this, what's going on. Bottom line is spondylolisthesis is a generic term that means you either have a slippage forward or a slippage backward of one spinal level on the other. So a slip forward or a slip back. Anterolisthesis means you have a slip forward. Retrolisthesis means you have a slip back. When I was in school and early in my career, there was only spondylolisthesis, which talked about both directions. So you need to know there's 5 levels. Level 1 is you have a 0 to 25% slippage. Level 2 is you have a 25 to 50% slippage. We're talking one vertebrae over another. Level 3 is 75 to 100% slippage. And level 4, 100% slippage. Level 5 is beyond 100%. If you get to level 4 or 5, that's where surgery is typically required to hold things into place to calm down your symptoms. But most people are at level 1 or level 2, and surgery should not even be talked about simply because you're not unstable and it's very common. Up to 20% of adults live with spondylolisthesis and don't even know that they have it, don't have symptoms, don't even realize that there's anything going on. It's not talked about that much simply because it's not that major of a cause of sciatica or low back pain. Like I said, up to 20% of adults have it and don't have any symptoms. So if you've been told you have a spondylolisthesis or an anterolisthesis or a retrolisthesis, guess what? If you don't have pain, don't worry about it. If it's beyond 50% slippage, that's where you start getting concerned, and that's usually where symptoms start to get really, really aggravated. The reason that these things slip is because you can have little bits of tiny fractures that are just giving way and allowing it to happen. It can be wear and tear of your disc that causes it, a number of different factors, but the bottom line is, for the most part, it's insignificant. Like I said, 15 to 20% of adults typically have some level of spondylolisthesis, most of them without even knowing it. They usually find out by accident whether they have an x-ray or an MRI for something else, and that's when they're told they have spondylolisthesis, which actually sounds more scary than what they thought they were dealing with. But please don't let it scare you. All right? The reason the pain may come, these holes here where the nerves come out the side, those are called foramen. Basically just a hole. The normal size hole is like that. If you have a slippage, you can see how the nerve can get pulled forward. That area of that hole where the nerve comes out shrinks, whether you're going backwards or forward. So you can get pinched by the bone. You can get the disc pinching in it. You can just get inflammation from the movement that pinches the nerve. And that's why you can get the sciatica symptoms, the burning, shooting, whatever you are dealing with sciatica. That's why it can happen, because you just have that extra stress in that foramen area that's causing inflammation. But the good news, and the thing that I want you to remember, most people don't have symptoms with it. And if you have sciatica as a result of spondylolisthesis, it is very beatable and treatable. So many times surgery gets thrown around real quickly with spondylolisthesis because it's so scary. But if you know what it is and you know that you can function with it without pain, there is absolutely no reason for surgery. Most people get relief with the right combination of gentle movements, specific strengthening activities, working on your posture, and overall just getting stable once your body is balanced. And just like with degenerative disc disease, herniated disc, and bulging disc, there's an insurance protocol and a specific protocol the doctors follow that starts with some physical therapy, which usually is pretty generic. Most of the time, they're going to tell you, please don't lean back and extend your back, because if you have a slippage of your disc or a slippage forward and you go to bend backwards, guess what? You are exaggerating that slipping forward movement. So you would want to do a lot of things that cause you to flex and bend, because what that's going to do, it's going to cause that slip forward to be pushed back. Typical general, easy physical therapy and then stabilization after the physical therapy is usually all people need. Oftentimes, small changes in the way you're sitting or standing just to adjust your body to a comfortable position is enough to ease the tension on that nerve and relax. So just remember, vast majority of people get great results without ever having to need surgery. So if you have a grade 1 or a grade 2 spondylolisthesis, surgery shouldn't even be talked about, because there's not a lack of stability. It's just a lack of mobility that can be changed with the right movements. All right. So if you've been told that you have spondylolisthesis and you're living with sciatica, please don't panic. Don't give up. You're definitely not broken. You are strong and you can recover, and you don't have to suffer forever. With the right approach, we can get your spine relaxed then stable. We can calm that nerve down. We can stabilize your spine and you can be pain-free. If you would like step-by-step help for this, please comment below. Me and myself or one of my advisors will get in touch with you so we can set up a consultation, a free consultation, to be able to walk you through and talk you through what we can do, how we can help you, because the programs that I have when you're dealing with sciatica, even as a result of spondylolisthesis, work like a charm. Once again, my name is Dean Volk with Sciatica Relief Now. Take care, and I'll see you on the next video.